The last thing an American needs is a mic. And that is the truth. All right, I'm going to jump in because I know that we're all fired up from the previous session. I'd like to keep that momentum going through. Welcome to the new people who've walked in. This is officially the best session you'll be in at all of NetHui. And if you don't believe me, vote for it afterwards anyway, because we have the NetHui conference app that does rate all the sessions. So I expect a very good rating. So can I have everyone's agreement to that? Is it a nod? Yeah, I'm watching you who said no. Yeah, I'll watch you the rest of the session. So this is about actually mobile health and social media in health. So we call it mHealth and social media, and it's basically going to be talking about that. So if you're thinking about talking about something else, you're in the wrong room. We also, by the way, have a Google Docs, which has been associated with every single session moving forward. We had a very nice man who was filling out the notes last time. So if anybody's keen to do it this time, this would be a very good time to, okay, fine. See, got it. It's a good thing I announced that. So it'd be great if if someone wants to check out the Google Docs and do some collaborative note-taking, it'd be really appreciated. Other than that, this is a conversation room. So we're going to talk a little bit about what social media and mHealth means, what it's encompassing, kind of get the juices flowing, and then we're going to pass it on over to you guys. My name is Perrin Rowland. I'm from the University of Auckland, and I do learning development for primary healthcare professionals. And I've been focusing a lot on social media and informal learning in that process. However, my knowledge of mHealth led me directly to the lady to my left, whose name is Robin Whitaker. She's up on the PowerPoint if you need spelling. And she's going to walk us through the kind of up-to-date research around mHealth and all that sort of stuff. So I've cheated. I'm passing it over to her, and I'm just going to sit here for a while. So, Robin?
Great. Thank you. So, yeah, first a couple of disclaimers, I guess. So I'm a public health physician, which means that I'm a doctor who focuses on prevention and wellness and planning services for populations, and I'm a researcher. So if you've been in the last two sessions, I feel like I embody all of the concerns that have been raised for the last couple of hours. So you can feel free to take it all out on me, that's fine. So, and also obviously I didn't get the memo, so I have prepared some slides. But I hope you don't mind, because what I'm going to do is just to try and set a bit of the context around mobile health particularly, and I hope that it will be useful and maybe a little bit provocative so that it will lead us into a good discussion. After I've done this, I very much want to lead straight into the discussion. I don't want to take over the whole thing. So hopefully you'll put up with my slides. Oh, if I can...
Here, want me to?
If we can move them along, that is.
Stage.
Okay. But that's not going to work. Sorry. So maybe should I come up there? Would that be easier?
It's up to you. Go for it.
Okay, so it might just be easier then. I won't have to keep looking around. So sorry about this now. I do feel like I'm giving a lecture, but I'll try and keep to the 5 minutes or so. So the first question was why mobile, really? And of course the answer is because it is everywhere. It is ubiquitous. So of all the new technology that has ever been invented in the world, practically this has had the most rapid uptake of any new technology to date. In New Zealand, we have more mobile phone subscriptions than we have people. And there are a whole lot of people in the world who are leapfrogging completely over the fixed internet stage and going straight to mobile. And what are they doing? Well, mostly text messaging, SMS, but mobile web is becoming one of the fastest growing components here. And while most people do not have smartphones, particularly in New Zealand, most phones are actually internet able. So there's a whole cohorts of populations, particularly lower socioeconomic groups, but also in the developing world, that are just going straight to mobile internet, bypassing everything in between, basically. So what sort of things are happening in mobile at the moment? This just gives you a bit of a summary overview, really, of where it's going. Huge investments overseas into mobile health startup companies. I've just spent a year in the States looking at this, which has been really interesting. A lot of investment going into really high-end technology, so we're talking particularly diagnostic devices and sensors on mobile phones or linked to mobile phones, linked to mobile networks. We're talking about a lot of really low-end technology in that same field. So we've got, on the bottom corner there, we've got a microscope attachment to a cell phone to be able to diagnose things like malaria and TB in the field, wherever you may be. There is a pocket ultrasound probe that really looks a bit like that, fits in your pocket. You can plug it into an iPhone and do an ultrasound wherever you are. Read the ultrasound on the phone or transmit it somewhere else for someone to read it somewhere else in the world. But also, of course, a whole lot of smartphone apps up there as well. We've been talking about their personally held health records. There are a lot of mobile apps for that. And there's an example up there where people are in control of their own health information and carry it around on their mobile phone. But that's all sort of quite high-end technology, perhaps not so relevant to us. But where the mobile phone itself, I think, is really, really relevant and can be used a lot, relates to these three words. It's because the mobile phone is personal, portable, and connected, particularly the way that we use it in this country. So it's always carried and it's always on, and that means that mobile health programs provide an option for people about integrating health into their lifestyle, because the mobile phone already is integrated into their life. We can provide programs that are very proactive and try to provide the right information at the right times for people, and they can be very personalised because your mobile phone is so personal to you. And of course they can be interactive and they can provide social support because your mobile phone is your connection to your own social support network, which is on your phone. So we have in New Zealand led the way in using it in this manner. So the unit that I work for actually developed the first ever text messaging smoking cessation program. Well, actually the first ever text message only health intervention. It happened to be to help people to stop smoking, sorry. So it's now called Text to Quit. We did a really big randomised controlled trial on it, so we did a high quality study on it around New Zealand, and it was the first such study in the world on a text message intervention, and we were the first to implement it as a national program. So this program has been going now for about 4 years. It's fully funded by the Ministry of Health, and it's just available as one of the suite of options that the Quit Group offer as part of their Quitline services. So you can go online and you can choose whichever of their services you would like, and this is one of the options you can choose on its own or with all of the other options that are there. So as I said, I recently talked to a whole lot of people in the US about the state of mobile health and where it was going and what are the problems with it. So I'm just going to give you a couple of bites of that to be a little bit proactive perhaps. So these were people right across the health sector and the mobile health sector in the US, and even though they're all enthusiasts, they did not all see mobile health as being a major priority to implement, as you'll see from that graph. They all saw that there were benefits that mobile added on top of what we were already doing, and these are some of the words that they used to describe what that extra was. The one in red is just because I happen to like it, persistent interactivity. But one of the biggest ones that I see personally is this reach into populations that are currently being underserved by the health system or are not able to access health services and health information. And we don't have good information around this in New Zealand, but actually they have really good information in the States, so which is why I put that up. But we have no reason to believe it's terribly different. In that there's something now like about 30% of households in the US are wireless. That means they have no fixed lines whatsoever. They only have mobile phones and only have mobile internet access if they do. And that those households are actually at the bottom of the socioeconomic spectrum. So those are households who are more likely to be living in poverty, who don't have health insurance, don't have a usual place to go for healthcare, and don't undertake preventative activities like flu vaccinations. So we don't have really great information on that, but it seems that we are heading in a similar way in this country. I thought this was really interesting, that the group of people I talked to, without me really asking, they put themselves on either end of this spectrum, really. So, roughly half of the people I talked to said, mobile is just a normal extension of what we currently do in health. It's either a normal extension of the way we deliver health information, it's just the next delivery method, or a normal extension of the way we currently deliver care in my area. And on the other end, the other half of people were actually saying, we think that mobile could be part of the catalyst, part of the movement that will move our health system from very provider and location-centric, so it's very hospital-centric or doctor-centric at the moment, to more of a patient-centred, anywhere, anytime care system, and also move that locus of control over health information from providers closer to actual people. Now, there were a lot of caveats that people put around this because this is not necessarily a good thing for everyone, perhaps. It depends a lot on how we do it and how well we develop mobile health. There's a lot of talk about if it's not developed by, with the right people involved, with the right consumers and our priority populations involved, then there's a chance that we won't do it well. There's also the fact that we need to give people the skills to be able to do this. If we really do shift the locus of control of health information to people, then we have to make sure that they have the right skills and resources and health literacy to be able to understand what it is that they're doing and the choices that they're being required now to make. So there's a lot of caveats around that, but I thought that was something interesting that we might discuss. And also, my interviews brought up a whole lot of issues to do with the implementation of mobile health, and we're not going to go into all of these, but just so you know that people are talking about these things and trying to act on them. The two in red were the two that came up most often, so privacy and data security as two separate issues came up most often in my discussions. Also a lot around how to integrate this into the health system in terms of clinical roles and accountabilities like we've been discussing, but also around into the health information systems that currently exist or are being developed. And the other biggest factor was the need for more really high quality research. So it came up really often that there's a lot of rubbish in mobile health. In the States there's a big focus on smartphone applications for wellness and for health, and there's a lot of rubbish out there that hasn't been well developed and is not being used. Most apps are downloaded once and never used again. So there was certainly a lot of discussion around a need for a better development process and a better research process in order to make sure we have high quality mobile health interventions that have been proven to be effective. So this is sort of just a statement to put out there. Where are we going? Well, according to these interviews, we could see mobile health as a catalyst to transforming the way that we deliver healthcare, and particularly what we're interested in trying to enable self-management, not just of long-term conditions, but self-management of our risk factors, as we've been talking about for well people who want to try and manage their risk factors for disease in the future. So that's sort of where we're going, I think, with it. And obviously, so this has been about mobile, but there is a huge overlap between mobile and social media, social networking. So we know from Facebook and Twitter and some of the really big social networking sites that the access to those sites by mobile is growing exponentially and is taking over as a proportion of how people access these. We also know that people are more likely to contribute to social networking sites if they access them by mobile and if they access them by PC, which is an interesting phenomena. And I think one of the other really interesting things that is coming out of social networking sites on their own is the patient-centred and directed groups that are growing just incredibly. So two of the really biggest ones that you may have heard about are Patients Like Me and 2 Diabetes. Have people heard of those? Yeah, okay. So Patients Like Me started from a small group of people with ALS or relatives of people with ALS. And it's become a patient site for people with rare conditions who want to talk to other people who have the same rare conditions, so they can talk about their symptoms, their progression over time, the types of drugs that they've tried, what's worked for them, what side effects they've had from different drugs. And it's become a very, very large and very strong community, online community for those conditions. 2 Diabetes is another one that's obviously all about people with diabetes, and there's a whole lot of different subgroups on there. So, for example, there are adolescents with type 1 diabetes or pregnant women with diabetes, and they become a group where they can talk to each other about tips and techniques for managing their condition and learn from each other and support each other to do so, which is a really interesting phenomenon that's come purely out of internet social networking. So that's all I was going to say. I'll let Perrin take over and run our discussion.
So Rob and I have had a lot of talks about how social media and M-Health tend to live in the same world, especially the fact that, it's hard to sort of separate the technology from the purposes that it serves. So I'd love to bring up patients like me at the top. Oh, you can. Oh, we have to swap. So what this discussion really is about, I think this is an opportunity to see how we've had a lot of discussions about how clinicians are on one side of the fence in the first two sessions and consumers are on the other side of the fence. And I think this is a real opportunity to sort of bring those fences a little closer together and talk about the cooperation that can come through using these technologies and having social media on our side. So would anyone like to start off or have anything to contribute? Do any of you use social media in health? Yeah, what do you do with it?
Tweet Facebook.
With health?
Yeah.
Do you want to give him a... Oh, sorry. He's currently talking. If we don't use the microphones, I've been told we look like gaping fish, which we can turn into an app later.
So I'm a health promoter at the Problem Gambling Foundation.
Okay.
And, so we use Twitter and Facebook to often tweet about the news. Obviously, Sky City's been in the media quite a lot recently. We have a sort of position.
We don't want to get booted out.
No, but we have a position in terms of increasing ratings and stuff, and it helps communicate with people. And we've found through what we've been putting up there, some people recovering from the addiction have messaged us privately. So it's raising awareness for some people, but also helping recovering people as well.
Cool. So a curative, in the sense of you're curating the information and distributing it. Yeah. A lot of personal knowledge management through those areas. Sorry, you had a comment in the back.
Yes, thank you for that presentation. I found that really interesting. I'm involved in the health sector, and one of the, and particularly at the policy level, and one of the things that I've certainly been keen about advocating on is, self-care, self-management, and people taking responsibility for their own health and well-being as the starting point. And, I think about that particularly across the population, but in particular in the Māori population, Pacific Island population, where, the health statistics have been, so appalling for such a long period of time, and we don't seem to be able to shift them. And I was particularly interested in your, as you were talking, I was thinking, about the extent to which this tool, could be a way in which that kind of process can be assisted, and so I'm also on the board of the Asthma Foundation, and we're currently in the process of engaging in a high-level research project around health literacy, and in particular around the hospitalisation rates of children, which are appalling for a country like ours, and the extent to which technology, and in particular mobile technology, can actually be a tool that we might think about as part of our whole research project, with the extent to which that tool can actually assist that population group. Again, Māori and Pacific Island people are disproportionately represented in those statistics. They lower socioeconomic group by and large, and also hard to reach population. And yet they have this technology they walk around with in their pocket. And thank you for that. The other thing I was thinking about too was about, this is with another hat that I wear, is around the extent to which New Zealand needs to innovate around the development of this technology as well. I mean, it's interesting you spent 12 months up in the States, looking at what they're doing, which is really, really helpful, the kind of technology that's being developed in this space. And Why aren't we doing it?
I agree. I think we spend too much time hearing about how New Zealand is an early adopter rather than as a forward innovator, and that the power of the internet really exists in its startup culture and the idea of innovation. I think another thing important to realize about social media, especially with the populations that you're talking about, this morning on Radio NZ, as I was coming into this conference, there was talks about how our health literacy is some of the lowest in the world in New Zealand. And the fact is that when people come into the doctor, the last thing they'll talk about is what they just read on the internet. And the truth is that what we read on the internet is something that resonates with us, despite how many degrees we all hold or how experienced we are on it. And so the fact that the health community needs to start getting involved a lot more actively, a lot more proactively in the dissemination of information, whether it comes from organizations like Lift Your Arm, Raise Your Arm Up, Hamish comes from, or if it's coming from a more sort of personal idea. The idea of knowledge management means that you seek out the information, you make sense of it, and then you share it. And sharing it is probably the most important part. And we had one back here. I'm going to pass over to Robin.
Just really briefly before the next one, so thanks very much for that. I really appreciate that. So there's a lot of conservativeness still in health and in research, unfortunately, so it's great to hear that you think that this would be really useful for those populations, because one of the most common comments I get back on my research proposals is, these people aren't using mobile phones for this sort of thing. They're not literate enough, or not using them in the right way, or, just incredible comments. So I appreciate that. And I think that I know there are a couple of really good apps being developed at the moment in the University of Auckland for particular remote and rural Māori groups around literacy, around understanding your medications, with great photos of medications and the description of them all and what they're for and why they're taking them, why it's important to keep taking it every day, what will happen if they don't take it, and so forth, which are all part of it. We can't just assume that we can put these things out there and people will use them unless they're addressing some of those issues around health literacy.
Sorry. Fraser, do you want to go first? Sure. Are you both Fraser? I thought you were in the back.
Yeah, I'm good to go, if you're right. Some of the things we're talking about today about products and about how we're disseminating and linking services to healthcare. And earlier in the day we talked about a specialist tool or a product that's used for people to engage with what they're doing, usually to manage something as opposed to prevent or stop from happening. Whereas a lot of apps today are very much have a treatment of, that app looks good, that's going to help me lose weight, or that's going to help me do this or that. And I think a lot of it goes down to the treatment. So I want to point out things like Nike Plus, for example, that's introduced an armband that monitors all of your activity. And I think that's looking at running and exercise and that kind of thing. But I think that there is a lot of opportunity in regards to language and how people actually understand what they're doing. Mm-hmm. And typically we say, you need to eat better, and that people already think of it in a certain way or a manner in regards to their behaviour and their understanding of what that concept means. And so maybe as part of that innovation, how we need to think about this kind of product and service development in the future is looking at what we're trying to achieve and what's the best way to approach it from. So if I was looking to prevent diabetes in a certain environment or a certain area, it's, what's the best thing we can do to deliver that? I don't know exactly, but I'm just suggesting it's about language and literacy of that area.
This is great. I get to plug research. I thought I was going to get, pilloried as the researcher. But yeah, so when we develop a new intervention, we're identifying a particular need, like it's an identified need that people have said needs to be addressed, and we can prove that from the statistics. But then we do a whole lot of formative research where we actually go to that target group, for example, people with diabetes or people with diabetes who are not well controlled, and we spend a long time with them working out what it is that they need and what would be helpful and how that will fit into their daily life. And I think that's one of the differences in approaching it from a research perspective as approaching it from a Nike, or IT development perhaps.
I suggest that can be the same thing. I think it's about how it's approached. But, yeah.
Okay, fair enough, yeah. Great, thank you.
Thank you. Uptake of mobile telephony has been incredible because with a hand-me-down phone and $10, you have a phone. You can call an 800 number for free for a health service. You can subscribe to a text service where a health provider sends you texts. You don't pay for that. you're not going to get cut off if you don't pay your bill at the end of the month on a prepaid phone. On a mobile app, on a mobile broadband app, these things that you're talking about, you can buy prepaid data, but you could use your prepaid data for the week or for the month, your $10, your $15 worth, just by watching 1 or 2 YouTube videos. Now, in the fixed broadband market, there's the idea of zero rating traffic, and this is done for entertainment providers. If you have a particular broadband plan, sometimes you can get some traffic for free. That idea doesn't exist in the mobile world. And I would suggest that when MED starts talking about USO telecommunications service obligation reform next year, that the health community needs to be talking about zero-rated mobile data access to these applications. Otherwise, you're never, ever going to get the uptake in the lower socioeconomic communities in New Zealand.
Here, here.
Yeah, seriously.
I have to plug my sponsors quickly for that, but I just need to say that Vodafone do support our research, and they provide zero rating through short codes for our research, but only for research, not when we actually try to implement it and roll it out at the end of the project.
Yeah, and I think that's a good thing actually to bring up for the bar camp, is the idea of like who needs to get involved in this sort of conversation, because the problem with health is that we're all supposed to wear so many hats. Like, not only are we supposed to make sure that everybody stays healthy, but we're also supposed to be IT experts as well as communication experts, as cultural experts. I mean, there's a lot of lists that we're all supposed to take on. I'm none of these things, by the way, just so you all know. And just straight up. And I think, oh, that's okay. So I think that with somebody, like the concept of what technology is and what it does, I think is a really hard thing to grasp for a lot of health people, and that we all kind of get seduced like we did in the 90s with wanting a website. Now we all want an app. It's like, ooh, you know what'd be great for that? You know what'd be great for keeping my hair straight? An app. Let's get an app going, because then we'll get on the scene. And it's about the pragmatic and practical use of technology in areas that really will have the uptake and the use of it. So Jenny, do you want to talk?
Yeah, hi. And I'm not a part of the health sector, so I guess I'm probably looking at this as a consumer or a patient even. It sounds like you've done some really important research. In that and in the discussions that you've had, have you drawn a line, or has anybody articulated a line of the limitations of mHealth and social media in the sector? Is there a top 3 or 4 things that you recommend to people that aren't done using social media or mHealth?
That's an interesting question. I mean, I'm more often asked to try to articulate the benefits, because people in the health sector more often can't see what the health benefits are, rather than they see things that we shouldn't do or are trying things that we shouldn't do. There are issues with all of this, of course. It raises issues, that we've been discussing in the last 2 sessions as well, around privacy and data security. On a phone is even slightly different than internet access on its own. There are issues around social media, of course, that we all know already, in terms of particularly around young people's use of them comes up quite frequently. There are issues which are not real issues that come up all the time as well, like in our developing our applications are predominantly using text or video. So you're looking at them like this, and one of the common issues I get asked about is brain tumours in kids. I'm not asking anyone to put a phone up to their head, I'm asking them to look at it here. So that's a really interesting question, and I would have to think about that.
Does anyone else in the room have a thought?
I just have a side note regarding what you're just talking about, how to prescribe some kind of treatment or look. And I think one thing we don't do widely is engage visuals or appropriate language. When I mean language, I mean visually, or actually communicate what you're trying to achieve. We very much defer to a text or numbers-based language when communicating, and I think that's a huge opportunity, especially in the work that you're doing.
Yeah, so we have developed some of our programs. We use video messaging, and this is around role modelling or observational learning, which is based on a whole lot of theory around behaviour change, how to try and support and motivate for behaviour change. And so it's around seeing people like me go through this, and they talk about what it's like, and they're ordinary people. And so we do a lot of video messaging using that, and I think that's very powerful because you can portray a lot of relevance and culture and language and context within a video that you can't do in any other way.
Just picking up on a comment you made when you did your initial presentation, mobile apps used once and not again. What are the lessons from that? I mean, what were they, and what should we not do again?
Yeah, that's a good question too. So, and there's probably a lot more to this, but I can talk about a couple of things that I'm aware of. So the evidence about what we know works in mobile health has actually got a lot to do with text messaging. So most of the research that has shown a good effect has been using text messaging, and I think that there's quite a lot in there about that immediacy of text messaging, that prompting, the alerting, reminding that we have this Pavlovian response to look at text messages and to actually open them. That it's about the timeliness and about someone sending you something directly. So we had people on our smoking study who said, look, I'd heard all of that stuff before, but it was the fact that someone was sending it to me directly over my phone makes it a hell of a lot different than seeing it on TV on an ad, and it meant more to me. So I think that the apps that have been developed don't use that function of mobile phones at all. It's basically like an internet program. You download it and then you're expected to actually open it again some other time and look at it. And there is no prompt, no reminder, no alert. It's just sitting there on your phone, and if you don't open it, it's not going to do anything for you. So I think that there is a lot more work to be done on making smartphone apps smarter than what they currently are.
And who's the best? Who does that? What does everyone think about? Who needs to be sort of driving good mobile app development?
That's a good question. What do people think? Who's a credible source to? If you wanted to find a smartphone app for your health, who would you go to? Where would you look for one to be delivered from?
Facebook?
The health system, isn't it?
Hopefully.
Your doctor, recommended by your GP? I mean, where would you go? Who would you ask?
Sorry, is this in response to the
Hi.
question?
Yeah, this is in response to this question, and it's not the name of a company or anything. We're still learning on this. We're still learning. We've actually learned quite a lot about text messaging. It's been with us a while. It's had a massive sample base, and some things failed. I think we've probably forgotten about the things that didn't work with text messaging, because we finally learned what really made it work for people. And it's not just the programs for quitting smoking or managing depression. Reminding you you've got an appointment tomorrow. I mean, that's become almost ubiquitous now. It took a while to get there, and we're actually researching. So this is actually where the consumers come back into the picture. If you're going to try something and you are experimenting, does this app work? You've got to go back to those people you've been asking to use it and find out what worked with them. It is just a case of keeping the conversation going as we learn together.
Absolutely.
The point I was going to raise is something I was aware that they were doing in Australia around online counselling for children, and how they were getting children to describe in that online environment how they were feeling, using colours and shapes, not necessarily words, because they weren't familiar with words given their age. Do you see that sort of service translating into a mobile environment? Because my understanding at that time was primarily around being able to use a desktop.
Absolutely. It's the obvious next place to go. So we developed a multimedia messaging program for teenagers that aims to prevent the onset of depression by teaching cognitive behavioural skills using video messages, cartoons, mobile website and text messages. So there are some quite simple tools that I think you will see popping up all over the place soon as those online programs, which have been proven to work, turn into mobile tools. And even within the health environment, I think you'll see them popping up on here. So there's a nice, really simple scale of faces for kids, from happy face through to really, really anxious face, and the kids just have to point, which one they're feeling at that time. That sort of thing, it fits perfectly.
Just in response to Iz's apps and things, as you said before, you can get an app for your hairdo, so it is very much supply and demand, and there's obviously demand there. Apps are relatively cheap to develop, and people will promote them, so I would imagine, raise the demand even slightly, and you'll probably get dozens of people keen to provide something. You just have to go on.
So where would you look if you were looking for one? What would you Google, or who would you ask for?
It would depend. I would say, if you want an app about smoking, you go to the group that sponsors all the anti-smoking lobby. If you wanted one, about diabetes, presumably you go to the manufacturers of diabetes drugs. The cost of these things is so very low in comparison to the money they're making from those products that they probably fall over themselves to.
My partner is an avid golfer, and I have caught, and I've caught him on surfing the iTunes store for golf apps. And I'm really surprised that nobody's happened to mention, if I'm looking for an anti-smoking app, I'll go to the iTunes store and I'll see how many reviews there are. Maybe when we're in the biz, we know that there's all these NGOs and there's all these organizations that do all this sort of thing. But I think if we start putting a few more consumer hats on, we start realizing, if I hear a great book, I'll go search the library website so I can make sure that it has an ebook on it, can go across. And I think we go to where we get the stuff. And I think we need to remember that a little bit more about access, because that's how you're going to find everybody. That's how you're going to find your consumers. It's how you're going to find your patients. Up to you.
Hi, I would actually concur with you just on that point.
Rock on.
I think if I was looking for something, I would go to social media. Is one of the first places. But the question I actually had was that a lot of the discussion was really being about things being pushed out from the centre out to end users who need some intervention in their health, but is very much coming from the centre. Do you see that there's any move in New Zealand to give opportunities for end users to make more contact with health professionals through social media? So rather than it being apps that are pushed out, they actually, if I'm concerned in some way about my health, perhaps not in a way that is so immediately serious that I know that I need to go to the doctor there and then, but I've got some niggles about something and I might put it off, and we will often see, and a complaint from health professionals is that people leave it too late to come and make contact about things, so that early intervention can bring benefits to your health. So are there, do you see that there are opportunities in New Zealand for that to happen, and how might that happen?
Well, I think that's a lot of different issues. I'm not quite sure where to start on that one. The reason I got involved in this panel is because I work with a lot of GPs, and I know of a GP who started up her entire practice off of Facebook, and I found that a really interesting idea. She literally started her entire practice off of her computer. She hung a shingle, she hung the shingle digitally, and I think as health professionals, we maybe forget that the first place a lot of people go when they find out they have something or they've got a weird bump or a strange rash, they don't pick up the phone to call their doctor, they go onto the internet and they look it up. And I think we underestimate that sometimes in the idea of push information. And where I find the whole thing really interesting, and I've talked to Robin about this, is the paradigm shift. When doctors used to make a lot of house calls, that was their role. They'd, in their gigs, they'd go around and they'd, have stories of people going out into the rural countries to make house visits. And then it switched. With patient-centered care, it became the patient defined how they're going to access people. They're going to go to the doctor, they're going to call the nurse. And now with the push technology, we have a real opportunity to start making house calls again. And the text responses from doctors, I work with a very well-known GP who works with mental health, and he has his practice nurse text his patients an hour, 2 hours, 3 hours after seeing them, just to confirm that everything that came out in session is okay and they're moving forward correctly. And so this is the sort of proactive thing I think we see a lot of people coming on. And again, I think it's about cooperation, about the groups coming together. This is a real opportunity, I think, for clinicians to step out and really talk firsthand with their patients, not consumers, their patients, the people they work with, as well as colleagues. And I know Michelle needs a one as well. Oh.
A TripAdvisor site for health apps. There isn't, and I have proposed this. There are similar things. There is one called iMedical apps, if people are interested, review medical apps, but they're particularly focused, it's a more clinical end, really, more than consumer end, certainly not so much wellness type ones. And there's a new company called Haptique, which says that they're going to do this, but I don't know that anything is out there yet. But they are trying to set up a rating system, a bit like Health on the Net or whatever that's called, in order to do it. But I think it's a great idea. The iTunes reviews are not enough. We are currently doing some projects to review apps in certain areas, like weight loss we're doing at the moment, to see whether they meet national and professional guidelines and whether they've had any research done on them or based on any research. So we'll try and get that information out when we do it. But I think it would be really useful for people, wouldn't it?
Hi. If you get to the point where there's a lot of apps and things out there and people are helping themselves out, have you got plans or processes in place to monitor how well those things are working? Because if the people think it's working, then you may never hear from them again, but it might not actually be working. So is there any monitoring in place, that sort of thing?
Yeah, along the same lines. Currently, there is no monitoring of it. They're very much, consumer-based and consumer risk. And I think that's another interesting aspect to those last two questions, is about GPs and other clinicians recommending apps that they know of and that they approve of, that meet New Zealand guidelines and are giving the same messages as what they are giving. And then when the patients come back to see them, then they would ask them how that's going, whether it's working for them and what it's doing for them. But at the moment, that's not really happening.
Yeah, just following on from that, what a key... yeah, okay. Following on from that, when I hear you say, I think it's really important that some of these apps in particular, if they're looking at condition management, do really have to meet guidelines. They've got to have some kind of clinical improvement. Are we really talking about some kind of heart tick scheme, like we do with food, that'll just pop up and say, these have been tested and we like them?
Absolutely. I would love to see that. Like the Diabetes Network New Zealand having on their website, these are the apps that we approve of, and the diabetes teams are then asking people, referring them to those and asking them how it's going afterwards.
Do you see a role for central government here in terms of some approved apps list meeting ratings?
I don't know so much about that. I guess that's an option.
What would be an alternative?
I know, I can give you the example, in the States, the Department of Health and Human Services, which is federal level government, actually producing some of their own apps, but the other thing that they're doing is they're producing libraries of information that can be used by developers. So, for example, they've developed whole libraries of text messages for emergency situations that then are freely available to everyone else who may then want to send them on to their networks. And they're doing the same for child information, child information. And so then other organisations or developers who want to develop an app or a program around child information can go and get the right information to put into their program. So, information that's consistent with the national messages on all of these things. And I think that's possibly one good way, one good role of central government.
Hey, my name's Kahutapu Black from Tauranga, I'm from Tauranga, and I work with rangatahi, with youth, and public health, and supporting them, creating opportunities and stuff like that. One of our roles, is also public health. I'm interested in the app you're talking about sort of early intervention app about depression and stuff like that, because there's a lot of youth that commit suicide and stuff like that. Apparently, estimated around 500 or something, which is higher than the road toll, of deaths and that. And I was just interested in seeing how much it'll cost to create an app like that can potentially be funded to help prevent suicides and stuff like that.
Yeah, thanks for that. That's great. And you know that the Ministry of Health at the moment is actually putting a whole lot more money into this area. So they are putting out requests for proposals around e-therapies, particularly for young people. So we're hoping that that there will be some money going into developing such programs for young people.
Because we also, we run a mobile doctors clinic in Tauranga, which goes to the poorer communities, and it's a free service for youth 10 to 24. We're also looking at creating an app it's probably already out there, to monitor vital signs and stuff, heartbeat, blood pressure, all that stuff. But that's accessible, for the not so rich, people in that. Yeah.
Absolutely.
Yeah. But true. Thank you.
Thank you.
Okay, we'll get to one and then one.
I just looked up there. There's 149 non-smoking apps, all free. So tons out there. On Keitha's point about roles for government, we have GeoNet giving us an app that tells us where every earthquake is taking place and how deep it is and how long it's lasted and what damage it's done. And we have Treasury putting out an app so we can read the budget speech. It would seem a no-brainer that there is a role for government in these sorts of areas.
Oh, kia ora. My name's Leona and I'm from Wairau Hawke's Bay. My question in terms of health is there's language barriers between doctors that are coming into communities, especially like smaller communities. And from experience, what I've found is with foreign doctors, there's that language barrier. So there's a lot of time taken on consultation. So a lot of consultation time is actually taken on them trying to understand their notes. And consultation with local health providers, they're a lot more quicker. So my question, I suppose, is how can systems and applications be more effective and more efficient? Because the downside of that is health not being addressed, and it's a simple face-to-face contacts that people go to the doctors for. Yet, because of time constraints on that appointment, they're not able to get the quality service. So, my interest is looking at better ways to service those foreign doctors. And a conversation I had with one of our local doctors yesterday, she actually identified that the language barriers.
So you're talking about the language barriers for foreign doctors, is that what you...
Well, in particular, in our small region, because there's been a few concerns, and that's due to quality of health service being shown to our local people. Yeah. And the applications that they've got on there is not really user-friendly, especially for other doctors coming into that are, not Kiwis.
Yeah, well, that's a big point. Yeah.
A big point,
yeah.
Oh, sorry. We bring up a lot of really good points, which is, we have a lot of technology being built out there, and probably not so much of it pays attention to the capabilities of the users themselves. And that's, I think, part of also this sort of free market economy, the idea that all these, the best stuff's going to rise, it's going to be passed on, and that's really where the sort of social media part of it comes into it. And that, we talked in the last session about trust. That really comes from people the people in your networks, the information that's being passed along to you. The idea of depression and youth especially is becoming such a hot button topic. We're going to see so many things come out for stuff like that. I mean, it's going to probably flood the network, especially with people wanting to kind of get in on that financial pie, unfortunately. But the point is that with a country this size, you have to have people working together, and you have to have that cooperation going on so that we're not repeating the wheel and that we are using the good stuff that comes out. And that comes through sharing that information forward and making sure that the conversation continues. We've got time for maybe one more question. Sasha, do you want to go?
Yeah, there probably is a role for government in helping to create that trust marketplace for all those private sector apps and stuff to work in, because they're not going to do it themselves. There is a tricky thing with health where I can make any claim I like on the internet, and if I say it persuasively enough, people might rate that pretty highly. And likewise, there could be an app that gets rated really highly because it's easy to use. It's just that it happens to be tied into a particular drug company's product or something. So government certainly has a role as a steward of the public interest over time to help create that kind of trusted marketplace where you can go somewhere and have a better than average chance of being able to tell what's good for you. Traditionally, we've done that by leaving it all up to doctors. We don't have enough of them. We're not going to have even the number we have. The number the amount of demand in the health system is doubling, and the number of people to meet that demand isn't, which is why you're seeing a lot of activity at the moment trying to push some of that healthcare burden back onto people. It's not just that we want it, it's the system can't actually cope the way it's been running at the moment. But yeah, to me, there is a public role in creating a kind of marketplace for knowledge and for trust and reputation.
I think that's a good place to end, actually, because I think we can all take from that is that we also have a responsibility to push it forward. We're here as NetHui citizens. We obviously have an interest in technology. We obviously have an interest in mobile technology. In fact, I feel very strange sitting here not watching the Twitter feed going on at the same time. So if any of you made fun of me, I'm going to find out later. But that being is that we do, we are citizens of the internet space, and we have responsibilities towards that. And I think that's the same thing with pushing forward information and pushing forward information that's valid. There's a transparency allowed, and because of that transparency, we're able to sort of validate things probably a little faster, I would argue, and that's the point of having stronger networks. Would you like to finish with anything? Oh, no. Okay. Okay, well, thank you very much. I hope someone kept this all in Google Docs, but if not, then it's their loss. And vote for the app vote for this conference on this app. And I think it's on to there's plenary sessions afterwards. And if anyone wants to come up and talk to Robin, she's right here. Thanks very much, guys.